Hi, everyone. I'm Elaine Beck, and this is my show. It's not about us, because it's not. And as always, my favorite word is excited, because I'm always excited about my guest. And I'm especially excited about my guest today because she's a friend of mine as well. And I want to introduce you to Dr. Mateja de Leonni. Say hello.
Hi there. Very nice to be here. A pleasure.
Oh, well, thank you. We're so happy to have you here. You know, I'm going to tell you a little story about how her and I met. And that you speak in anytime, okay? We're real open here and having fun is the idea. But the way that we met was, sadly, my daughter was diagnosed with early onset Alzheimer's. Well, actually, at that point, she wasn't diagnosed. She was having problems and going to see some doctors to try and clarify exactly what it was, right? And so, here I am, very concerned mom, love my daughter. She's very young for having Alzheimer's. She's 52 years old. And so it was a struggle, but we were trusting God, as we always trust God, right? It was a good idea to trust God because he came through. I went down to the southern part of the world on a trip. And while I was gone, I got a text from my sister-in-law. And my sister-in-law said, your good friend, Kathleen, on her radio show this morning, she had this wonderful doctor. Her name was, I can't remember it, but I think it was Deli something. And she said, you need to call her as soon as you get home, because she was talking about she has a way to stop the progression and possibly even reverse problems with Alzheimer's. Well, I was overjoyed, but as always, I try to compose myself and think, don't have too high of expectations because you never know about these things. And so at the same token, the minute I got home, the next morning, I called Kathleen. Kathleen told me it was Dr. De Leonni, and immediately reached out to her. She immediately sent me a text. And the next thing I know, by Friday, we'll skip all the other part. Well, no, we can't. The phone call that we had first with her husband, my daughter's husband and her, and Mateja, we'll call her Mateja from now on, she's my friend. From that point on was just to talk about whether or not she should see her. And during that conversation, already her and I started talking about other things we had in common. I don't even remember who dropped what word to make it so. But the next thing you know, we were fast friends. We started talking about my daughter first and God and what Christians we were and how much we were, what she did was to help others. And I just respected her from the get-go. But I want her to share with you a little bit about, how she has this gift of, since she was a young girl, wanting to be someone to save people from Alzheimer's, and then take it from there.
Yes, what a privilege to be here, Elaine. Thank you.
Thank you.
So I have to start out by saying I am not American.
That's right.
May sound like one by now, but I had a journey where I left my home country of Slovenia truly to become a neuroscientist, to become a neurologist, and in the hopes of one day of being able to significantly help, let's say, in treatments of Alzheimer's disease and other brain disorders. I happened to run away from home at the very onset of the Balkan conflict and the Balkan Wars. And that was quite a journey on it by itself. But when I came to this country, I did know not know anybody here. I did not have relatives. I didn't know where I was going. And it was only by grace of God
Amen.
and by grace of good-hearted Christian Americans in this country that I was able to survive, physically survive, mentally survive, and get the help of going where I needed to go. It was Christian women in East Tennessee 34 years ago that
Wow.
paved the way for that. Believed in me, so I was, a high school exchange student when I first came to this country, and there was a local reporter, a couple of high school teachers, good Christian women who, were just flabbergasted how they had this kid in front of them who, talked about how bad communism is and how what measures I took to get away from that, and just my just fierce burning desire to learn more about the human brain, all aspects of brain function, and then ultimately my focus or my interest specifically was in this horrible, horrible neurodegenerative disease that we call Alzheimer's type of dementia.
Well, I'm going to ask you a question that anybody out there is thinking, if they're paying any attention at all. Why would a young girl have that in their mind? Who did you see, or what did you know, or what did you read, or where did you get this, that you were determined to find answers and help save people's lives?
So I had the good fortune of growing up with my grandparents on a big farm. I come from a long line of farmers. I was the first one in the family to even finish high school, let alone to go on to higher education and, get all the degrees that I have. But we were raised as good Christians.
Right.
And it was a couple of different experiences in my very early childhood that sort of ignited, if you will, this desire. And really, it was desire to learn about what makes us tick in colloquial language and in terms of like aspects of function. So I grew up with 5 cousins of my grandmother's who were either deaf mutes or deaf to a particular degree. So,
Right.
and they were literally discarded by their own families because nobody, wanted to deal with people that were different and that different in, back in the 50s, let's say.
That's right.
Or even the 60s. There was no, school for the deaf, nothing like that set up in those times, at least in the former Yugoslavia.
Right.
I hope I already said that I am from the country of Slovenia, which used to be a part of former Yugoslavia.
Yes.
So, I was always surrounded by people that were different. And I mean, I was raised by them because they all worked on my grandparents' farm. They were part of the family. To us, they were not any different.
Right.
But I would see, how my grandparents actually opened up an I guess what you would consider now an Airbnb on the farm
Wow.
back in 1968. That was way before I was even born.
Right.
And so we would have people come literally from the entire Europe and later on in the 80s from the entire world to visit the farm and stay there and so forth. And you could see, a lot of folks just visiting would very much look down upon to these people that were different. So that was
Right.
and hearing loss, because it seemed to be something that ran in my grandmother's family.
Right.
That to me was just like one of the most fascinating things. Now, I'll tell you, there was also something that my grandmother used to do to prepare for food for the upcoming week for the guests and for our family. And as I said, we had an extended family of folks living at the farm, probably about 10 of us,
Right.
that she would have to feed. And we had all kinds of animals on the farm. But particularly on Saturdays. In the afternoon, she would always go behind our barn and kill anywhere between 10 to 20 chickens. So we would have fresh meat, fresh
Right,
chicken, for
right.
the upcoming days. And since I was the only kid around, the only helper in that, very early on, I was recruited to help her with that.
Right.
And I would witness many, many times how one of them would get away.
Right.
And the way she would used to do that, she had this big tree stump. She would
Mhm.
take an axe and she would literally grab the chicken and, cut the head off
Right.
and the throat. So there were many, many occasions where the chickens would actually get away from her with their, flinging heads sort of leaning
Right.
over, and the chicken would still be running around, and
Yes.
there's blood everywhere and so forth. So not a pretty picture, but to a 5-year-old girl, that was the most fascinating thing
Yes.
that I could ever possibly think or dream or imagine witnessing. So even early on, my grandfather passed away in 1994, but I was his girl, his little girl.
Yeah.
And he was not educated because he grew up during World War II,
Right.
but he was an avid reader, so he knew a lot of things. And I remember him telling stories to many folks that would visit, how I was 5, 6 years old, and I would ask him about, what is in the head? What do we have in our heads that makes us be the way we are and makes us function? And he thought that there was actually something wrong with me for the longest time.
Yeah.
Thank God they didn't have a whole lot of psychiatrists back then in the country, and they took me to the local priest, to kind of, get me into the church life and so forth, but which they thought would sort of help along, because they thought that was very unusual for a little girl
Right.
to have.
Exactly.
But he put me on the path of, reading books that sort of spoke to people being different.
Right.
And I don't mean like having their heads cut off. I mean like just stories about different experiences in
Sure.
life. Very early on, I was introduced to Anne Frank's journal and those kind of books and
Right.
so forth. So again, that was, if you ask me about what ignited this in me very early on, I think those were the kind of experiences. And
Life experiences.
Life experiences. All the other things we had to take care of on the farm, and that was, that was just part of life.
Right,
People
right.
probably can't imagine submitting their young children to something like that now, but those were different times.
Well, and the thing is that happened on the world around in those days.
That's true.
That's how we all lived. I remember my parents living on a farm when I was little. We moved in with my aunt and uncle before I was even born. They moved in there once.
Mhm.
And so this is not unusual, but your curiosity, your determination, your intelligence to seek answers. A lot of kids hear something like that or get one answer and they walk away like, okay, I know that. They're done. I find it just wonderful that you felt a desire to know more. You couldn't get enough of it. And then at a young age, how old were you when you ran away?
I was a teenager. I was almost 17.
Yeah, almost 17. So 16 years old. And you run away from home, and you didn't run away with the intent to just get away. You ran away with a purpose.
Correct, towards something.
Absolutely.
For me, that was, what had motivated me, and I would have probably gone through even more drastic measures to get to that.
Right.
And, just to be able, again, by a set of circumstances or, divine powers
Divine,
almost.
that's what it is. It's
Yeah.
always the divine.
I was able at the time to be in a school that had the first access to some internet, and I was able to. So I schemed. I was the one who went on the internet and started learning what would be a legal way to emigrate to the United States. So the best plan I could come up with was at that time a high school exchange student.
Right.
After that year, I had no idea what was going to happen with me.
Right. But that makes it even more intriguing because here you are, you've made this great move and decided, and then you started researching and you're going to make it happen. I love your drive that you've never given up. And now you've been through many, many different things and nothing stopped you. You had the help, divine help from many people around you to get you to where you are today. And I think we're going to save the rest of your life story for another time because we decided that today we want to especially just address what you're doing now and how important it is and how few people know or understand that there are things out there and ways that if you find, now correct me if I'm wrong, if you find the Alzheimer's early enough where, you're just starting to have some cognitive problems, little forgetting more than, everybody forgets every once in a while when you walk through a room to get something, you forget what it is. I did that when I was young. There are certain things, but there's signs that you notice that all of a sudden you're different. You're not remembering things as well. Maybe it's names, maybe it's dates, maybe it's the thing that you used to claim that you knew so well, like you could remember any telephone number, and now all of a sudden that's not happening. Isn't it a good thing to go to the doctor quickly after that so that you can find it early?
Absolutely. Absolutely. And I tell you, I count my blessings every day. I think I'm the luckiest person alive because before I went to medical school, I did study neuroscience. So I went through the entire research track of undergraduate studies, master's, PhD, postdoc. And
Wow.
it was and then I ended up going to medical school. It was back then that we were doing, and I was, again, just by divine intervention, ended up being a part of a research group that was doing the first research on the new Alzheimer's medications that we have now available.
Right.
So that was my path, I think, again, divinely chartered for me. And then I realized that we were far away from clinical utilization back, in the late 90s, early 2000s. So I knew if I really wanted to help people like I did and serve people, I needed to go to medical school and learn more and learn different aspects of that.
Right.
And really a whole lot nothing much honestly happened in that time where I was training and then going through my residency and fellowships and all that to all of a sudden, nothing happened in terms of novel findings, research
Right.
findings in that span of 20, 25 years compared to what I initially had worked on. So I had all this research knowledge, but we didn't implement it. And then fast forward, to just 5 years ago,
Right.
4 years ago,
4 years
is where we had the first approval of one of these, what we call now amyloid targeting therapies to sort of modify the progress of the Alzheimer's disease that first came to the market. The first one of those drugs was called Aduhelm, and I was probably the first and the only neurologist in the United States, meaning the world, who had a lot of patients who were cash paying for this medicine because no insurance, nobody wanted to cover either the diagnostics and or the medicine. Okay?
Right,
So
right.
I had a tremendous advantage in that space to realize that these are finally the drugs that are going to they're not the answer to this disease, but they are a significantly advanced stepping stone so that we can change the course of Alzheimer's treatments completely.
Right.
So as a clinician, then I was able to jump to that and offer, offer these treatments to the community. I have to say that the first medicine, even though it was FDA approved, was never deemed "quote unquote" good enough to be, accepted by the wider medical community.
Right.
But then it was just 2 years ago, end of July, that the first medicine that is now covered by everybody, well, once we take them to court,
Twist their arms and
twist
it'll
their
work.
arms, yeah, in a legal way.
Right.
Well, it's gotten better, but we're still kind of working on that. But that was one of that's one of the main and first accepted treatments, these medicines, and about a year ago, the second one came out. So we really have two of these and they're all infusions that we can administer to people. But I want to make a point in what you were asking me, okay? So we have gotten exceedingly good at being able to establish what cognitive decline is that you would expect with normal aging, let's say.
Right.
Because we know that a process of aging as it pertains to the brain is that we all lose some brain volume over time, right? And we know that a brain that you look at on a scan, like an MRI scan or a CT scan, looks very different at age 20 than age 50 than age 80 or above. We also know that some cognitive decline and some aspects of cognition, let's say, do decline with age. Now, we are also have developed these tools that help us now distinguish, what is normal for somebody at age 75 or 65 or 55 and what is not. And that, involves different technologies from an imaging standpoint. That involves doing pretty complex cognitive testing to really look specifically at cognitive domains. Now, dementia, the colloquial definition of dementia is memory loss plus one. Okay. And that means that you have to have some memory problems, but at least one other cognitive domain has to be affected. Anything from language to executive function and all the other ones we talk about.
Okay.
So again, over the years, we have refined these tools to really detect these things very early and very specifically, okay? Now, just in the last couple of years, we now have developed blood markers that can detect your risk or evaluate and detect your risk for Alzheimer's type of dementia, specifically because we know there's a significant genetic contribution to Alzheimer's disease, many other neurological diseases as well, but at least we now are able to put that to clinical use and identify folks, that are at risk. And let's say if they come in with this, maybe some short-term memory loss, maybe finding it difficult to remember names, maybe finding it difficult to kind of just multitask, at the same time. Those are all aspects of what I hear day in, day out from people when they come to present and wonder if this is a little bit more than what you would suspect for their age.
Right.
So in that regard, it's been refining of various diagnostic tools and then development of these blood markers that we now use to determine who is a good candidate to have this medicine or not. That means that we are now, in the old days we said you can only diagnose Alzheimer's post-mortem. So when people die
Yeah.
and we dissect their brains and we look for these different toxic proteins in the brain. Now, we do now with scans, particular scans. So we, in general, we screen with blood markers, and then if somebody's at risk and they want to confirm the disease, obviously we do the confirmation scanning as well.
But that's also very amazing. I think the thing that I think most people now are wondering, how do you know whether you're a candidate to even go have the testing? But I think that, we answered that pretty well, that if you're really noticing something, major differences at all, don't be afraid to question it. I mean, you can go to most any doctor and get a cognitive test, the first one.
Correct.
Okay, so start there. So we're not suggesting you immediately call up, a neurologist. But if you keep seeing signs and other things that are obvious to you, and maybe not to anybody else, but to you, but then if somebody else mentions it, especially, I would say, then you need to call and ask. The thing that I understand, though, that I want you to share with everybody is I understand there's only 2 doctors in the state of Arizona that do the treatments like you do, yourself and one other.
Well, that's not completely true anymore, thank God.
Thank
right?
God,
For the
yes.
longest time, I was really the only one in the community.
Right.
So there is a lot of research actually in terms of clinical trials being done within the Banner system in particular. There's a
Right.
Dr. Sabah up in Phoenix that is leading a lot of that research. There are some other ones in the community that are also doing clinical trials, but then also, offering these treatments now to people in the community where it really needs to be.
Yes, but wait a minute. Not to interrupt you, but a clinical trial is when they give you either the drug, now this is my understanding, the drug or a placebo. I'm not going to I'm not going to go through that if there's already something there. I want to know who actually has the ability to give me the drug that I need, not just risk whether or not it's right or wrong and if I'm going to live or die. Does that make sense?
It does. And with that, I would just comment that, clinical trials come in various stages, right?
Okay.
So initially, we got to prove whether this one substance that we're trying to, evaluate whether that works against placebo. So that's how all the clinical trials start. But then as the process goes further along, some patients stop the clinical trial. Some people go on for further stages of this trials. So it's not necessary that, all aspects of clinical trials are like that.
With a placebo.
Correct,
Right.
yes.
Okay.
But initially, all of those do have to be run that way. And
Right.
and I mean, I understand, your thinking on the subject, because if you're already vulnerable, you want to be treated. You do not want to be sort of a somebody
Guinea pig.
Exactly.
Isn't that what they always call it? You don't want to be a guinea pig.
Exactly.
Yeah.
It's a guinea pig
You need
type of
help.
a metaphor.
Right.
So I was, it was again just sort of by my background alone that I think I really early on as a clinician realized that there will be that these things, that all of a sudden came to the market may not be the overall answer to curing Alzheimer's disease, but they were such a significant advancement compared to the last 30, 40 years of treating Alzheimer's patients or any memory loss type of patient. So I just got very involved in terms of, all aspects of this, from, systems that are in charge, insurance companies, you have to have an infusion suite of some sort to give these drugs. So the whole environment where, even though this is out of the hospital, it's outpatient
Right.
setting, thank God,
Right.
it's still, it's a pretty complex system and factors that have to come together to be able to offer these medications to patients that really need them.
Okay, so
And
now share the good news with us.
the good news,
That you've had some patients that
right? So I will say, because I had started offering the first drug, the very first one that came out to folks, everybody knew that I was in a community that I started doing and these treatments. So I had I was set up, well to do these treatments. And when the medication that is in use now, the Leqembi or lecanemab, came out, I remember it was at the end of July of 2023. The FDA approved it, and I started my first patient treating them with that medicine the day after the FDA approved it, which like
Wow.
hardly ever happens,
Yes,
right? But it's
exactly.
because this patient, was already through all the diagnostics, and this particular one happened to have had a few months worth of treatment with the first drug. But we chose to switch to the newer one that was approved. So again, I had a cohort of patients that were all set up to go and start this new medicine. It was a very exciting time. I remember it was also a very scary time.
Sure.
So these medicines are the so-called disease modifying agents. So everybody stays away from calling them the cure. Okay?
Right.
Because what they do is they significantly modify how the disease itself progresses. Now, they will only be able or have the power to do anything when we detect the disease in the so-called mild cognitive impairment stages, or what we also call early Alzheimer's disease stages, right?
Right.
So the assessment of that happens in a pretty detailed, sophisticated way. So I don't want people to think that everybody all of a sudden is a candidate to get treated with this.
No,
unfortunately, right? Unfortunately. But this is just a huge, huge shout out to my colleagues, to anybody and everybody that potentially will be listening, to get out there and get screened for
Right.
the reasons that you mentioned earlier. But even if you are not noticing cognitive changes, and you know that your grandpa and uncles or aunts had issues with memory loss and cognitive changes later in life and so forth, I truly believe, Miss Elaine, that this, with some variation and maybe some combination of treatments in the future, and we're not far away from this, these kind of medicines will be administered to young adults who are vulnerable, who are at risk of developing the disease later in life. But when administered these treatments early, that will make sure that they never develop the disease to begin with.
Yeah.
And like I said, we're probably not very far from that.
Well, as a mother to someone who's dealing with it, and as an older woman who has seen some of those markers in my own life, and as a person who just wants to help everybody that I can, and we share that in common, and our
Right.
love of the Lord and stuff, I would have to say that I hope that people understand that it's not just medication that helps these things. It starts with prayer. It starts with trusting God. It starts with eating the right things, staying away from certain things. I hope to see something in the near future where we can give people sort of a preventative diet, even, that people should, or just things they should stay away from,
Yes.
and that type of thing. And I think we all need to start thinking healthier in this country. We're learning through Mr. Kennedy how our whole lives change by the stuff that we're eating in this country that's not good. I'm supporting him. I'm supporting what he does and supporting you as a doctor. And I think that we all should just, rethink the future but start out with the kids and let's get them off of all this garbage that has added to the possibility of causing it to happen.
That's absolutely correct. And I think you hit hard on an aspect of the disease itself that I've not mentioned before. So again, I said that, these new medications, as good as they are and as long as we've all been waiting for them, are not the answer. No. So they're part of the answer, but not the full answer. And absolutely, we know now sometimes people call Alzheimer's disease as type 3 diabetes. And in essence, what they're saying is that this is a metabolic disease that sets up this incredible inflammatory processes in the brain. And that is what we put into our bodies, what we're surrounded by, all those are so-called modifiable factors, right? That most of us have some control over. Those play a significant risk also. In the end, who actually comes down with the actual disease and who does not.
Right.
So again, in my practice, all the folks that are on these medications, are also prescribed or at least counseled upon dietary changes, supplements, fasting regimens, and all kinds of things that we include. So again, not just medications alone. And I will tell you, I'm sort of a lonely wolf neurologist that approaches treatment of patients in this space in this regard, but again, only due to my experiences and vastly due to my research experiences in studying the disease itself for such a long time.
Right.
And it is just absolutely crucial, to get screened and have people come and realize that this has a lot to do with genetics as well. So pay attention to that as well.
Yeah. Well, my daughter in particular, that's the only one I can really speak to, is that, in her case, she does have the genetics from her dad's side. Mm-hmm. And that was there. But moreover, she was totally addicted to all of the artificial sweeteners. And it's drank diet sodas and diet this and diet that, and used all of those sweeteners in her coffee and in her tea and, all these years. And now we're finding out that those are a disaster. They're toxic chemicals that you're steady feeding your body that is not meant to go into your body. Right. And in time, anything like that's going to have to build up or cause, there's always an effect or cause and effect, right?
Right.
And so that's what we're seeing. And so I really want to encourage, particularly the young people, if you hear this and you hear and listen to this show, it doesn't sound like something that, a show about Alzheimer's, but we're not going to call it that. But it doesn't sound like something that's interesting to you unless you have a parent or somebody, a grandparent that's dealt with it. But let me tell you, I see everything as everything starts today from the moment that you understand and hear something. Don't say to yourself, oh, I'm 20, I'm 18, I'm 30. That can't bother me for a long time yet. No, it's the buildup of this stuff that I think as someone who studied a little bit, now deals with it with my daughter and that, start young, eat healthy, eat smart. Fasting is a wonderful thing. It's talked about a lot in the Bible. It was used for many reasons in the Bible. And so it can't be all bad. So fasting doesn't mean going without completely. It can mean fasting all day and only eating dinner. It can mean, only eating early in the morning and a lunch and fasting from lunchtime till the next morning. It can mean a lot of different things. And that doesn't mean that it's not as important. It means it's actually very important to get into a practice of rotating different types of
fasting regimens. I think this is actually even more recent
Yes.
knowledge that we have, even compared to these new Alzheimer's medications. We only now know the power, what kind of a power fasting regimens have on the brain cell and really body cell ability to sort of cleanse itself, rejuvenate itself, and in that regard get rid of the cellular poisons
Right.
that are involved in the development of various diseases, not just Alzheimer's. Rather, we know that's true for Parkinson's in particular as well.
Right.
So I'd say, just being mindful of that and get educated. And, there's no shortage of information out there, and there's for sure no shortage of patients.
Absolutely.
And when I talk to people, I mean, there's hardly ever anybody that I've ever met that wouldn't have a friend or a family member or somebody that would not have been affected by this disease. And so it is very common. And I think that one thing we need to do, and I think the community needs to come together and force us in the medical field to be very proactive. So when you go to your primary care doctor, demand a cognitive test.
Absolutely.
Demand these blood tests that are available to anybody and are covered by the insurance. If they don't want to do it, or more likely they don't have the knowledge on how to do it or what to do, get educated. Everything is, all over the internet, and come seek help to those of us who have the knowledge to do it and have put systems of care together where we can do that in a very, very short amount of time, let's say. So, the worst enemy is time when it comes to this disease. It is a progressive disease. It's neurodegenerative. That means it gets worse day by day, meaning symptoms get worse day by day. And because we have this, absolute cutoff, a threshold, at which point we find some of these new things to be helpful, and not just harming, that those early stages are so important to be brought to somebody's attention.
Well, we could talk about this for hours because there's many subjects. There's many different things to look out for. There's many things that you can do to make yourself healthier and to live better and all of that. But we'll have to do that another time, or you'll have to do some of that research she's talking about, because we're way over on our time. But it was a wonderful, wonderful thing for you to come in and share with our audience this information, because there's one thing that we can't do. We cannot cure what we don't understand. We cannot find ways to make ourselves healthier if we don't know the signs and we don't know that there's help out there. So I really appreciate it, Mateja, Dr. De Leonni, that you've taken the time to come in and share with everybody that there are answers. We have a huge following now, and I hope that everybody hears this. Number one, first, pray for everybody else. It usually gets you a lot of rewards. Second, pray about yourself and look into yourself and ask yourself, is this something I need to ask my parents about? Is this in my family? Do I need to look at what I'm eating and how much of these things that we've mentioned that aren't good for you that you're intaking all the time? You need to ask yourself, how can you make yourself healthier in many ways? And so we just want you to know that we love you and that we pray for you always. So pray for us, and that we will see you in the near future as we speak to you of many things that God gives us to share with you for your betterment, because He loves you. Thank you.